Sandy Conradie, and yeah, I'm busy doing my master's and working as a researcher at Stellenbosch University in the Department of Health and Rehabilitation Sciences. And so I'm going to present on public stroke care services in South Africa and what do stroke survivors think. So the background to this is that globally stroke incidence is increasing and has become a major cause of disability in adults in South Africa, which places extra strain on public healthcare services. Optimal stroke services improve a person's well-being. Evidence generated from patients' experiences of these services can inform healthcare decision-making for quality and equitable services. We shall share the experience of perceptions of stroke care in the public system of South Africa and discuss implications for healthcare practitioners. So basically what we're going to do from there is we're going to, I'm just going to read what the quotes that we got from the participants, and then from there, I think it's up to us as healthcare practitioners to reflect on those quotes. So this is just part of a larger project which we're doing with the London School for Health and Tropical Medicine. The overarching project's name is Perspectives and Preferences of Stakeholders to Strengthen Delivery of Stroke Care in the South African Public Health System. So what we conducted semi-structured interviews with 15 people with stroke living in urban and rural settings in the Eastern Cape and Western Cape. And they had to be within 24 months post-incident. What we did with rural Eastern Cape is we went with a rehab assistant working in that area who translated the interviews for us. And then the others we did via Zoom and my WhatsApp and phones. And we collected that between September and October last year. And then the interviews were transcribed, coded, and thematically analyzed. Our participants were aged between 33 and 68 years of age, 8 females and 7 males. And it was also split between was it 7 people in the rural area in Eastern Cape and equally rural urban, same in Western Cape, equally rural and urban. So our results were that there were both negative and positive experiences. So the negative experiences were along the services continuum of care post-stroke and at all levels of care. But our positive experience we found were mostly linked to positive relational engagement with healthcare workers. I have to say at this point, a lot of what we're saying in that quote is from Kate Cherry, Steve Reed, and Madeleine Duncan's article in the SAHR. So I just have to give acknowledgement because they just worded it so well that we just couldn't, we wanted to just take it word for word. And then so from our results, we found 3 main themes that are related to healthcare services in South Africa. So one was the service delivery challenges, limited person-centered care, barriers to optimal use of existing resources. So yeah, and then the last one was what we also found in these person-centered engagements that often outweighed the negative experiences with the healthcare services. So what we found is that in the interviews at the end, it was mainly positive, although they had all these negative experiences, but because of the healthcare workers giving them that positive engagement, it outweighed the negatives, and they were actually really positive about the care that they had received. All right, so what I'm going to do is I'm going to go through the themes and share the quotes, and then after that, I think it's mainly like up to us for discussion. What are we going to do about this, about these experiences that people have had, and how we can either as healthcare professionals change our practice, or how can we change the health services to help? And I think just to add again, just the importance of the end user perspective. It's all good and well. So in this study, this qualitative study that we did, we also interviewed healthcare workers to get their perspective on the systems, but it doesn't help just we know what healthcare workers think. We know there are challenges, but what can we see from the person's point of view? And we really realize how important that is to get that input and kind of work that together with the healthcare person's point of view. So the first one was service delivery challenges. And I think this is something we all know, but it's just always too important to present it. But this quote was, "We waited for too long. The ambulance only arrived at 9:10 at night to take me to the referral hospital." He didn't say what time he arrived at the hospital, but it was in the morning sometime. And then this was just to show also that is then how far and how long it takes to get to the referral hospital. So not only did he wait at the referral hospital, they drove on road conditions like this, and that was the distance. The next one was, when the staff gave me my medication, they didn't say what the medication was for. They only told me how to take the medication and told me to continue with this medication from my local clinic. Then I went to the clinic, but I was given a different medication from the clinic. The medication that I got from the clinic, I didn't recognize. It was not the same as the one I got from the hospital on discharge. I just wanted to pause for effect. Next, it was limited person-centered care. The other thing I was told, why the one side of my body wasn't working well at the hospital. So they told me I had a stroke, but they didn't say why. Why this? Because of the stroke. Why had I had the one side that was weak? The next one was also limited person-centered care. And the other thing I hated very much, when I saw him, sorry, that's a doctor, I asked to speak to him in private, and he told me specifically that is not an option. And it was in the setting of a crowded waiting room. Also still limited person-centered care. So they just told me that I mustn't miss my appointment for my medication and take my medication on time. So what I'm trying to depict in the photo was that this is where they're staying. That's where the clinic is. And don't miss your appointment, go pick up your medication, but don't take into consideration that the person has to travel all the way to the hill over there, possibly not, like Marika said yesterday again, possibly having a wheelchair, needing to borrow transport or pay. I know in the Eastern Cape they pay extra if you want to load your wheelchair into the car. So yeah, that's just what I was trying to depict with that picture. Then the barriers to optimal use of existing available resources. My sister have to come every day to see. They have given me the meal correctly, and if they changed me, there were nurses just up there. They only came to check every now and then, where you're lying in your urine for a few hours. I don't want to lie. It wasn't nice. Barriers, the same barriers to optimal use. I was satisfied with the care that I got from the nurses while I was waiting for the ambulance. The care at the tertiary hospital was not as good as the one at district hospital, but we were given things like food, breakfast, lunch, and supper, but we were not given water to bath. Okay, so those were all the negative experiences, and we can all agree, and those were only a few isolated quotes we thought that made an effect. So we can agree that's not nice to hear. And even though as healthcare professionals, we try to make it better, but you can just imagine lying in your own urine for how many hours, or lying in a hospital bed sick, tertiary hospital, so it's far from home and you don't have water to bath. And you can see the nurses are there. But yeah, and so that's why it's a mixture of, we themed it, but some of them were an overlap. So there's just to put emphasis on service delivery and person-centered, and not saying that it's maybe the nurses' problem, but the nurses, there was maybe the nurses a systemic problem. The nurses were busy with another person, etc. Or I know often what happens is that there aren't enough nappies in the hospital, and so the nurses kind of have to choose, do I change your nappy now, or do I leave you in it for a while and then change it later? But the positive experiences, and yeah, I'd really recommend reading the study that Kate and Stephen and Madeline wrote in the SHR, which just gives a great, Kate has a way with words, and she just beautifully explains how these positive experiences, no matter how isolated they were, how much of a difference that makes, and I just think as healthcare professionals, we can just reflect on that and think on that. I know from my side, when I was very hungry that one time and wasn't friendly to someone who had traveled very far to get there, and yeah, not given. So positive experiences. They gave him good care at Pozzolo Clinic, so I was supposed to take that out. And the fact that they left him to skip the queue to see the nurse first. The physio working with me spoke to me mostly and told me how to do the exercises with him. She also gave me some papers, but she first cleaned him, dried him after he was laying there for so long in a wet bed. She dried him and put him in a kimby on for him, and I signed for a wheelchair, a newer one. So also just to put this into context, this was during COVID time, and people were often left isolated in a ward because they were trying not to mix in with the positive people. But what often happened then was that the number of staff was very few, because some of them had been infected, or some of them needed to look after the much worse persons with COVID. So can someone mute, please?
I'm good. Sorry, I'm using a laptop.
Did you have to be muted?
Yes, I did.
Guys, can you mute? Herman, can you mute yourself? And Jikanati production, please mute. Okay. So from experience, we just also really are we Jikanati? Sorry. So I think an important thing that we experienced during these interviews were just, again, how COVID almost just brings out some of the effects and the effect it had on persons with disability and how much it worsened it. But looking at this physio was working alone in the hospital because all the other staff were off. But she took the time to go in and clean him. And in that case, I think she even went to go and search for his clothes because they'd lost his clothes. And yeah, so that experience for them was, even though they had had this horrible experience in the hospital, but just the fact that the physio took the time and cared for them enough. The physiotherapist said I must call my husband so that he could tell him the way he is going to help me at home. So again, just taking that time to follow up, to make sure that once you get home, getting the family involved. Yeah. Okay, so again, Kate, where these person-centered engagements often outweighed the negative experiences with the healthcare system. So that's just something to reflect on. And in conclusion and discussion, like I said, although some participants experience poor continuity of stroke care, it cannot be generalized to all persons with stroke in South Africa. These findings provide insight of how stroke care services in SA are perceived, which highlights aspects requiring attention. As healthcare practitioners, we should reflect on how these findings may influence our behaviors and decisions when interacting with stroke survivors and their families in the future. And just then in acknowledgement, we were funded by NRF and the NHIR, and we worked together with the London School. So I don't know how much time we have. I want to do questions, but it was 5 minutes. Okay. The idea was also just to have a discussion around just thinking we've got these perceptions now, and what are we going to do about that? And yeah. Questions. Let me stop sharing so we can see if there's anything in the comments. Okay. Okay.
Hi, I'm Kathy from Siakwazi, and I don't know much about stroke patients, but while you were talking, I realized a lot of the difficulties and the challenges faced for those patients you spoke about is also some of the challenges we face working with children and their parents with disabilities. The biggest one that came to mind was relevant to the work we do is the lack of feedback of knowing what the medication is that the child has to take, the lack of feedback of the diagnosis of the child. So not saying that there is no feedback, but possibly understanding what that feedback is. So yeah, just to say from our side, that is also a very big challenge in our work, and it's something that we are trying to support through referral processes and trying to support some kind of paper feedback coming back to us to support better understanding.
Thank you very much, Tandy. I need to ask a question. I know stroke is usually associated with a lot of shock, a lot of emotional, and a lot of trauma, especially to the patient and to the family. So seeing that therapists are the ones who are closer to the patient and who spend a lot of time with the patient and doing many things, like you said, bathing, which is I think is good. I understand you are going an extra mile, but I would like to know, like, does therapists also offer like psychological assistance to the patient?
So that was one of our other findings, and in the project in which we presented in our feedback session, was just how much emotional difficulties there were with persons having had a stroke and the impact it had on their life. And that was one of the things that come up. So generally, therapists do try and work through the emotional help. But I think sometimes it's limited. So I also just have to comment on, because of COVID, our sampling, or our, what's the word I'm looking for, how we chose our participants was influenced by COVID, and what we had to rely on was therapists informing us on who we could interview. And because those therapists answered, it kind of, that meant that we were already getting, our participants were people who were receiving good care. And that was something we really had to reflect on here, was that this, like we said, is isolated, and it's people who are getting good care. But so I think most of them were getting that support, but there's only so much that therapists can do. And that's something else that we found, was that the persons with stroke don't know what to do after that, or some of them didn't. The therapist didn't address it, and one of the other feedback was, I don't know where to get a counselor. How do I go about getting a counselor? or if they wanted to get into contact with the social worker, we don't know where to go for that. We don't know what to do. So it definitely is a challenge. But I think in those places where it's possible and where therapists are aware of it, and I think that's also just awareness of remember and the person-centered of care, remember to include their emotional status, their mental health status. And some of the things that also came up were things like the grandmother normally had her grandchild sleeping in bed with her. But the mom said no, and the grandchild was quite distressed, and the grandmother was distressed because that was what they were used to. The child slept next in bed with her granny. Or some of them was their dad came home and they were just so shocked because their dad was looking completely different. And just how that, listening to those persons and the impact that had, that your children are scared of you because of what had happened to you, and not understanding why this